Question number 1, sclerosis of the human phalanges and several pencil cup erosion most likely diagnosed psoriatic arthritis. Pencil and cup erosion most likely diagnosed psoriatic arthritis. Question number 2, 3-year-old boy with macropapillary rash, radiograph of the hemorrhage, resolution diaphyseal lesion, cortical thinning, interstitial scalloping, and mild periosteal reaction. Chest shows auricular and auricular shadowing in an upper zone of epidermis most likely diagnosed Langerhans histiocytosis. In the hint, there is involved more than one system. So it's skin, macropapillary rash, and a humerus and reducing diaphyseal lesion, and then in lungs there will be reticular shadowing in upper zone predominance, most likely diagnosed Langerhans histiocytosis. Question number 3. 3-year-old boy with collapse of T12, T11, 12, and L1 vertebral bodies. Several punch-out lesions in the skull with sclerotic edges, most likely diagnosed Langerhans histiocytosis. Again, it was more than one system. Question number 4. 7-year-old presents with back pain, mild fever, and leukocytosis. Collapse of the lower thoracic vertebrae, most likely diagnosed eosinophilic granuloma. Collapse of the lower thoracic vertebrae seen in eosinophilic granuloma. Vertebra plana. Question number 5. Eosinophilic granuloma most commonly seen involving bones. Even sarcoma most likely to be bone to be affected is femur. Even sarcoma most likely bone to be affected is femur. Laminated onion skin parachute reaction most likely diagnosed Ewing sarcoma. Laminated onion skin parachute reaction most likely diagnosed Ewing sarcoma. Number 8. 8-year-old boy with aggressive looking lighting lesion in the medial diaphyse of the proximal humerus. Circumferential extraosseous extension of the tumor with the immune signal similar to fat on two-weighted images with surrounding edema most likely diagnosed Ewing sarcoma. 8-year-old boy with the lesion in the medial diaphyse of the proximal humerus. Circumferential extraosseous extension of the tumor. Circumferential onion skin seen in Ewing sarcoma. 96, question 9. 86-year-old man shows multiple well-circumcised reducer lesions in iliac wings of the pelvis and well-defined punch-out lesion in the femur shaft with diffuse osteopenia, most likely diagnosed multiple myeloma. Multiple well-circumcised reducer lesions in the iliac wings of the pelvis and well-defined punch-out lesion in the left femoral shaft with diffuse, most likely diagnosed multiple myeloma. Question 10. Multiple lytic punch-out lesions seen in spine, pelvis, and rib, middle-aged man seen multiple myeloma. 11. Foot pain in regular runner, subtle parachute reaction to the second metatarsal shaft, bone scan shows focal tracer uptake in the second metatarsal region, most likely diagnosed stress fracture. Foot pain in regular runner and then subtle parachute reaction to the second metatarsal shaft, bone scan shows focal tracer uptake in the second metatarsal region, most likely diagnosed stress fracture. Stress fracture is best seen on MR stir. Stress fracture is best seen on MR stir. Question 13. Tarsal metatarsal alignment. What is normal alignment in this area? Second metatarsal alignment middle uniform. Tarsal metatarsal alignment normal alignment is second metatarsal alignment middle uniform. Which two bones does the left triangle ligament attach to? Second metatarsal and medial cuneiform. Which two bones does the left triangle ligament attach to? Second metatarsal and medial cuneiform. Number 15. Rugged dirty spine is seen in which condition? Renal osteodystrophy. Rugged dirty spine is seen in which condition? Renal osteodystrophy. Number 16. Rugged dirty spine is seen in hyperparathyroidism. Rugged dirty spine is seen in hyperparathyroidism. 17. Pain caused in elevation of shoulder like investigation is MRI shoulder. It shows detail of all muscles and ligaments. Question number 17. Pain caused in elevation of shoulder like investigation is MRI shoulder because it shows detail of all muscles and ligaments. Question number 18. This pulse at C5, C6 level, best view to see nerve root compression is sagittal. Nerve root compression sagittal and C-span view is parasagittal. Okay. But best view to see nerve root compression is sagittal. This pulse at C5 to C6 level, best view to see nerve root compression is sagittal. Another MCQ that comes in front, it will say that C-spine view is best seen as parasagittal, but when that comes, you will see. Now, best view to see nerve root compression is sagittal. Question 19. Cervical spine is best seen on MRI at which? Parasagittal view. Cervical spine is seen on MRI at which view? Parasagittal view. Question 20. Film of the cervical spine which is abnormal. P on the lateral view, the soft tissue anterior to C2 are 9 mm thick. Film of the cervical spine which is abnormal. On the lateral view, the soft tissue anterior to C2 is 9 mm thick. 21. Question number 21. Scaphoids collapsing. Lateral displacement of both the lateral margin of C1 house and is described. Jefferson fracture. Lateral displacement of both the lateral margin of C1 house is energy described. Jefferson fracture. Question 22. Nasal spine absorption seen in leprosy. Nasal spine absorption seen in leprosy. 2023, heel pad thickness seen in acromegaly. Heel pad thickness is seen in acromegaly. 24, well-defined lighting lesion in the calcaneum, central ossified nodule, high signal T1 and T2, most likely diagnosed intraocular lipoma. Well-defined lighting lesion in the calcaneum, central ossified nodule, high signal T1 and T2, high signal T1 is packed, so intraocular lipoma. Question 26, factor to the growth plate and amplifies the intact amplifies which cellular health is type 3. Factor to the growth plate and amplifies with intact amplifies which cellular health is type 3. Sector 3 amplifies with intact amplifies which cellular health is type 3. 27, factor to the pies and amplifies but amplifies is not involved. Correct classification factor is cellular health 2. Factor to the pies and amplifies but the amplifies is not involved. Factor the correct classification of this factor is type 2. 28. Solitary lighting lesion expanding the cortex of the proximal tibia, MI shows fluid level, multi diagnosis, and neuron bonuses. Solitary lighting lesion expanding the cortex of the proximal tibia, MI shows multiple fluid levels, most likely diagnosis, and neuron bonuses. 29. MI shows large lesion rising from the posterior elements of G2 and comprising multiple cysts with fluid levels with preservation of the vertebral body, most likely diagnosis, and neuron bonuses. Large lesion rising from posterior elements of G2 and comprising multiple cysts with fluid levels with preservation of the vertebral body, most likely diagnosis, and neuron bonuses. 30. Heart swelling at the distal radius and neural bone cyst was diagnosed. Modality of choice is MRI. Heart swelling at the distal radius and neural bone cyst was diagnosed. Modality of choice is MRI. 31. The alpha angle refers to the angle between the iliac bone and the acetabular margin. The alpha angle refers to the angle between the iliac bone and the acetabular margin. Okay, alpha angle refers to the angle between alpha angle refers to the angle between iliac bone and acetabular margin. Question 32. 4-week-old female with positive family history, which would confirm DDH in a child, beta angle greater than 77. Which will confirm the DDH in a child, beta angle greater than 77. Question 33. Most specific for diagnosis of DDH is dynamic breath scan. Most specific for diagnosis of DDH is dynamic breath scan. 34. Regarding developmental dysplasia of the hip, which is not a recognized risk factor to teratresia. Regarding developmental dysplasia of the hip, which is not a recognized risk factor to teratresia. 35. Wrist pain, sclerosis, and deformity of the lunate, which is correct, Kienbach disease. 35. Wrist pain and sclerosis and deformity of the lunate, which is correct, Kienbach disease. 36. A young adult male has a history of fracture, now with bone irregularities, diagnosis osteomyelitis. Young adult male has a history of fracture, now with bone irregularities, diagnosis osteomyelitis. 37. MI is contraindicated to a metallic aortic valve. Best investigated to exclude an auricle focus osteomyelitis is scintigraphy using technetium 99M monodiphosphate. Is common. MI is contraindicated due to a metallic aortic valve. Best investigated to exclude an occult focus of osteomyelitis is scintigraphy using technetium 99M diphosphonate. Is common. Okay. Question 38. Most common organism causing post-operative osteomyelitis is Staphylococcus aureus. Most common organism causing post-operative osteomyelitis is Staphylococcus aureus. Question 39. Best agent to detect acute osteomyelitis is technetium 99M diphosphonate. Best agent to detect acute osteomyelitis is technetium 99M monodiphosphonate. Question 40. What is the best investigation for acute osteomyelitis? MRI. Best investigation for acute osteomyelitis? MRI. Best investigation to exclude a focus of osteomyelitis is scintigraphy using technetium 99M monodiphosphate. 41. Shoulder pain following rugby, anterior skin of the humeral joint, which associate injury to the humeral labrum, likely Bankart lesion. Shoulder injury and anterior dislocation, most likely diagnosed is Bankart lesion. In acute anterior dislocation, there is seen the Bankart lesion. Then 42. Regarding Bankart lesion, a shoulder dislocate on anteriorly. 42. Regarding Bankart lesion, so shoulder dislocate on anteriorly. 43. Abnormal lucency in the skull on X-rays, Pacinian granulation. Abnormal lucency seen on the skull X-ray is Pacinian granulation. If they say normal lucency in the skull, then answer is leptomeningeal cyst. Normal lucency in the skull is leptomeningeal cyst. Abnormal lucency in the skull X-ray is Pacinian granulation. 44. 3-month-old child, CT defect in the right temporal bone with integer scallop margin and prominent GSF space, a line adjacent to right temporal separamegalia, diagnosis leptomeningeal cyst. 3-month-old child, CT defect in the right temporal bone Meninges scalp margin, she has a permanent, she has a face lying and doesn't create meningeal cells. 45. Benign parachute reaction bone is none of the above. Benign posterior reaction of the bone is none of the above. 45. Benign parachute reaction of the bone is none of the above. These are all aggressive. Question number 46. Cranioidectally, incurving little finger on palmar planes. Cranioidectally, incurving little finger on palmar planes. 47. Characteristic appearance of giant cell tumor, soap bubble appearance. Giant cell tumor, soap bubble appearance. 48. 40-year-old mother is eccentric, spine-side lesion with a narrow zone of transition in the lateral femur condyle extending to the subarticular bone. My well-defined bone lesion intermediate to giant cell tumor because it extends to the subarticular bone. The narrow zone of transition diagnosis giant cell tumor. They also show multiple fluid levels. 49. Metastasis from giant cell tumor is to lung. Metastasis from giant cell tumor is to lung. 50. In patient with rheumatoid arthritis, what is the commonest pulmonary finding seen on chest radiograph? Pleural effusion. In patient with rheumatoid arthritis, commonest pulmonary finding seen on chest radiograph is pleural effusion. 51. 56-year-old female has erosion of the lateral end of the clavicle, superior notching of the third to fifth ribs, and narrowing of the humeral acromion space, most likely diagnosed is rheumatoid arthritis. 56-year-old female has erosion of the lateral end of the clavicle, superior notching of the third and fourth ribs, narrowing of the humeral acromion space, most likely diagnosed is rheumatoid arthritis. 52. Most common cause of erosion of the entire pec is rheumatoid arthritis. Most common cause of erosion of the entire pec is rheumatoid arthritis.